So you've got stomach symptoms. Is it IBS? Is it ulcerative colitis? Or could it be Crohn's? What's the difference? I'm Dr. A, a GP based in the UK, and stomach symptoms, bowel problems, obviously massively common, and a lot of people still don't know the difference between IBS, Crohn's, or ulcerative colitis. So ulcerative colitis and Crohn's disease come under an umbrella term called inflammatory bowel disease, which obviously means inflammation in your gut. Now, there are some major differences between the two. So in Crohn's, the whole GI tract can be affected, so you get inflammation anywhere from your mouth all the way down to your back passage. But in ulcerative colitis, it's just the large bowel that's affected. And in Crohn's disease, the whole thickness of the bowel is affected, but in ulcerative colitis, it's just the inner wall of the bowel which is affected. Now, this is not specific, but generally in ulcerative colitis, you get pain on the left side of your abdomen, and in Crohn's, it can be anywhere. And also in Crohn's, because the whole GI tract is affected, you're more likely to get mouth ulcers, skin tags, and perianal disease, such as boils, abscesses. A common feature that is often seen in ulcerative colitis over Crohn's is false urges. This is when you have a sudden urge to open your bowels, yet when you go, nothing comes out. Now, in both of these, you're going to get some common symptoms as well. Most commonly, they're all non-specific, such as diarrhea, abdominal pain. The diarrhea may have mucus or blood in it as well. You may be feeling tired all the time, feel very bloated, have a lot of gas, and be losing weight. Now, if we suspect ulcerative colitis or Crohn's, the first thing we'll generally do is a blood test. We'll check things like your inflammatory markers, which may be raised, your white cells may be raised, your ferritin and vitamin B12 may be reduced. And if there's any indication, the next step will be a stool sample, check something called fecal calprotectin. If this is raised, you'll need a referral. Now, to confirm the diagnosis, you probably need a colonoscopy, an endoscopy, and maybe an MRI as well. Now, this brings me on to IBS. Now, there's no one test we can do to diagnose you with IBS, and the key thing to know is that it's a diagnosis of exclusion, which means we have to rule everything else out before we diagnose you with it. And it can be IBD, it can be gynae problems in women, it can be bladder problems, kidney problems, muscle problems, autoimmune problems. These are just some of the things we need to look into. The key thing is, though, that you're thoroughly investigated for any abdominal symptom before we diagnose you with IBS.